to remind all speakers, there will be a signal. One bell ring. Remind you that there is 3 minutes left before time's up. And 2 bell rings. It means that time already finished. And 3 bell rings remind you that 3 minutes already late. So if you hear bell ring, please kindly remind yourself to speed up and wrap up your presentation for timekeeping. The other special information to online audience and attendees, I would like to call for your kind participation to turn on your camera and change your own background to be the background of this conference as same as my background, okay? And the background is already sent you via email. Could you please kindly participate to change your background and open the camera? This is because we would like to keep your photos during the presentation and during the Q&A session and correct in the gallery of our conference events. Lastly, don't forget to mute your microphone during attending the presentation. And if you want to ask a question during Q&A session, could you please type in the chat feature of this Zoom? I will be a person who leads your questions to the presenters. Thank you. Now, okay, I think everybody looking forward to this moment. We will start to the first presentation with the topic of Co-red, innovative of new herbal formula for blood lipid care, integrating the science of traditional Chinese medicine and modern medicine by clinical professor Dr. Bhasakit Wannawibool from the College of Oriental Medicine, Rangsit University. Dr. Bhasakit Wannawibool, please.
I'm not sure that he is in a meeting because last few minutes we told him that we will start at 2 p.m. past 30.
Let everyone
So
see the slide already?
Okay.
Good afternoon, ladies and gentlemen. My name is Clinical Professor Dr. Bhasakit Wannawibool, College of Oriental Medicine, Rangsit University, Thailand. And I am pleased to be here today to talk about the innovation of dietary supplements for high blood lipid. Top leading cause of death in Thai population and world population are cancer, cerebrovascular disease, and cardiovascular disease. One major cause of both vascular disease are deterioration of atherosclerosis from high cholesterol and unhealthy lifestyle. High risk of vascular disease related to blood lipids. The optimal ratio between bad cholesterol and good cholesterol in healthy blood vessels. We expect total cholesterol and HDL may be less than 4. LDL and HDL may be less than 3. Triglyceride and HDL may be less than 2. Statins are the most effective and most commonly drugs used to control blood lipids. It helps to prevent inflammation of blood vessels, blood thrombosis, and restore endothelium function. The intensity of statin therapy, it can classify to high, moderate, and low intensity. Although these are groups of statin drugs. Although rovastatin are the most effective and more potency lower LDL than other statins, but they still have the same side effect like other statins. So there are doubts about what the cause using statin. The side effects of statin are muscle pain, joint pain, easier type, increased diabetes, liver damage, kidney impairment, nausea, vomiting, abdominal distension, neurological problems, memory loss, weaken, and impotence. The mechanism of statin is to inhibit enzyme HMG CoA reductase with control cholesterol production in the liver. At the same time, it also reduces the production of coenzyme Q10. Atorvastatin decreased the coenzyme Q10 level in the blood of the patient. About 49% after 1 month statin use. You can see that after we use statin for a period of time, the statin, the CoQ10 level decrease, and when we stop it, the CoQ10 level can increase again. CoQ10 involve the production of cellular energy and serve as an antioxidant. Coenzyme Q10 distribute in all organs in the body and is decreased year by year, indicated a relationship with aging. Low CoQ10 also lead to high LDL, and that means that it makes higher risk of heart disease too. This is to summarize as the side effects of long-use statin. I had an ambition to innovate new natural herb formula that can actually balance the level of lipids in the blood, strengthen the heart, and stimulate blood circulation, prevent the forming of blood clot and lipids, and atherosclerosis in the artery wall without side effect, and can be safely long consumed. The discovery of statin. Dr. Akira Endo discovered the first anti-cholesterol statin called compactin or myostatin, which he isolated from the fungus Penicillium cetunum in 1976. In 1978, Merck Research Laboratory discovered a potent inhibitor of HMG coenzyme reductase in the fermentation batch of Aspergillus terreus, and in 1987, lovastatin became the first statin to be approved in the USA by the Food and Drug Administration. What about Co-red? Co-red is innovation dietary supplement for high blood lipid. Important ingredients are regicide plus Chinese herb formula. What about regicide? Regicide comes from the rice fermentation with monocaspase spurious, become regicide, and regicide contains monacolin K. Monacolin K had the same structure similar to lovastatin and myostatin. So we can say that monacolin K is a natural statin. Monacolin K in regicide can lowering cholesterol and LDL. The important components of Co-red is one, regicide. Regicide has recorded in Chinese herbal medicine Qin Tang Dynasty 800 AD, and regicide is being used very often in Asian cooking and for making certain types of wine. It can stimulate blood circulation, break down blood clot. This regicide used as the color in Asian cooking. The fermented bean curd, the baking duck recipe. The Fujian red yeast wine, homemade fermented rice. We also combine another Chinese medicine formula to work as a teamwork combination Co-red. The second component, we use coenzyme Q10 that it can help the process of production of cell energy. The third one, we use sanja hawthorn, the Chinese herb most used in Chinese formula to reduce blood fat, can stimulate blood circulation flow, reducing blood clot formation. This is the hawthorn tea, and its active ingredient is hawthorn soup. It can suppress the total cholesterol and LDL level. It can strengthen cardiac output. Another one, we use sanchi, ginseng sanchi. Martial arts fighter always use to kill in blood building, blood stasis. Sanchi also had the property to stop blood bleeding. To stop bleeding, pain relief, stimulate blood circulation, and so break down blood clots and nourish blood. Blood chemistry and result record. Patient blood lipid profiles were checked before and after taking Co-red. Taking 2 capsules per day, it can reduce total cholesterol about 20 to 25% in 1 to 2 months with no side effect like statin drug. Kidney and function and liver function tests are normal, 3 or 4 years follow-up. It is the parameter of blood lipid profile and kidney and liver function tests. You can see it is the some blood chemistry report for of the patient. Co-red can reduce the cholesterol, triglyceride, and LDL, and also can reduce the enzyme SGOT and GPT after we use replace of statin. To summarize, Co-red has the 3 properties in one. It can reduce cholesterol, strengthen heart, and clean blood vessels. So Co-red is one of new herbal supplement innovation and also a new alternative choice to those who want to take care of their blood lipids. Co-red can be used for prevention and treatment. That brings the presentation to the end. Thank you for your attention.
Thank you very much, Dr. Bhasakit. It's such an excellent presentation. And this is a kind of innovative product, right? And is anyone have any question? Could you please put your question into the chat room, please? Anyone would like to ask Dr. Bhasakit about his presentation?
If you have any further question, I will be happy to talk to you later.
Yeah. You can email him. Okay?
Yeah, you can contact me by my email address.
Let me ask you.
Yes.
Let me ask you one question.
Yes.
And about your innovative hair herb. I would like to know that how long that we need to take this Co-red herb in order to control the level of lipid
Yes.
in the blood.
Yes.
And how long?
Yes. We can see the result in 1 month, not more than 2 months. 1 or 2 months, you can see the result. It can reduce the cholesterol, total cholesterol 20% to 25% by 1 month. And you can check out if someone that takes statin before, you can stop it, and you can take Co-red replace or instead of statin. It can reduce from the normal. If you have like you have 240, you can see it can reduce about 20%. And if you use it for a period of time, you can reduce the dose of Co-red, and you can check your liver function, kidney function, and also see observe about the muscle pain, the try. When you feel try from using statin, you can see the result very quickly. So also the enzyme SGOT, SGPT, if you take statin, it increase. You stop it and you change. You can see the result, the effect of statin, and also the SGOT, SGPT also decrease.
Thank you. Because now I see the question in the chat room. Someone also would like to ask you about this kind of question. He
Yes.
asked you that can use Co-red couple with statin and pelvic medicine, and you already answered. Thank
Yeah.
you very much.
Thank you very much.
One more question.
Yeah.
About this product already launched or already offered in the market?
Yes, already on the market. You can
Okay.
contract me and I can tell you the detail. What
Okay.
the
Thank you
ICNB.
very much, Dr. Bhasakit.
Thank you very much. Yeah.
Next, shall we move to the second speaker?